are the most important part of the mouth. They help us chew, speak, and look good. Can you imagine what it would be like if we had no teeth? We have two sets of teeth during our lifetime, 20 milk teeth and 32 permanent teeth. Milk teeth begin to erupt 6 months after birth and permanent teeth erupt at the age of 6, after which begins a phase where both milk teeth and permanent teeth are present up to the age of 13. After this age, only permanent teeth are present in the mouth. The last teeth to erupt in the mouth are the wisdom teeth by the age of 18 to 22. A tooth has 3 layers. An outer hard white layer known as the enamel, a middle yellow layer known as the dentin, and an inner layer made up of nerves and blood vessels which keeps the tooth alive, known as the pulp. These marvelous 32 teeth are embedded within the bone of the upper and lower jaws and are covered by the gums. Did you know that one of the most common and neglected diseases in the world is cavities? A cavity is an infection of the tooth. But unlike other infections, if neglected, the effects of this disease are permanent. So why do we get cavities? The most common reason for cavities is not keeping your teeth clean, like not brushing regularly or not brushing at all, or using the wrong techniques and the wrong toothbrush. The second most common reason for cavities is the consumption of a lot of sweet, sticky, and sugary food like chocolates, ice creams, sweets, tea, coffee, and bread. What happens when we eat a lot of sweet, sticky, and sugary food or don't keep our teeth clean? A thin, sticky film builds on the teeth first. Germs along with food particles in your mouth get attached to this sticky film and produce acids which create cavities. A cavity first begins as a small blackish spot which is painless and often not noticed. This small cavity becomes bigger with time and neglect and reaches the middle layer, resulting in sensitivity on drinking water or eating food. When further neglected, it invades the innermost layer and the patient will have severe pain, sleepless nights, swelling, and pus, and will not be able to eat. If further ignored, this swelling can become much larger, can spread further to other structures, and may eventually even result in death. You may say, we have 2 sets of teeth. Why should we try and save a milk tooth if it's going to fall off anyway? The permanent teeth form just beneath the milk teeth. Any damage to the milk teeth will also cause damage to the permanent teeth. The milk teeth guide the permanent teeth to erupt in the mouth. If the milk tooth falls off too early, the permanent tooth does not erupt in the right direction, leading to irregularly arranged teeth. The child will have a much higher chance of developing cavities in the future. If the infection in the milk tooth is neglected, it can spread to the developing permanent tooth below. This may result in swelling, severe pain, pus formation, and the permanent tooth may not erupt at all. When a permanent tooth is lost, chewing, speech, and looks get compromised. The adjacent teeth, in order to fill the empty space, move towards each other and cause irregularities, leading to further difficulty in chewing and speech. The jawbone that previously supported the tooth is lost. The inability to eat properly will compromise your daily diet, resulting in many other diseases like malnutrition, decreased blood in the body, weakness, and retarded growth in children. When cavities enter the second layer, they can be treated by a simple filling. But when they go deeper into the pulp, an extremely complicated and expensive procedure called root canal treatment must be done in order to save the tooth. In worst case scenarios, the tooth may have to be removed completely. If the tooth is removed, it must be replaced to prevent further damage to other teeth. Replacement may be by dentures, crowns and bridges, and implants. Unfortunately, none of these replacements can compensate for the lost natural tooth. Luckily, this dreadful disease of the teeth can be completely prevented by taking a few simple steps in your daily life. Brushing twice a day, flossing and using a mouth rinse, avoiding sweet, sugary and sticky food, eating nutritious food, and regular visits to the dentist. It is extremely important to brush twice a day, especially in the nights, using a proper brush and proper technique. You must use a soft bristled toothbrush, which you should change once in every 3 months. Make sure you use a toothpaste containing fluoride. Brush for at least 2 minutes using vibrations and sweeping motion, and brush all the surfaces of all the teeth. Do not use charcoal powder, rangoli powder, sand, or anything else. Brushing only removes the dirt on the teeth. Flossing helps remove the dirt in between the teeth. To floss, roll 18 inches of floss around your middle fingers and gently pass the floss around the curves of the teeth in a to and fro motion. Make sure you do not use too much force or cut the gums. Along with brushing and flossing, mouthwash helps reduce the number of germs in your mouth. Take 20 ml or 4 teaspoons of the mouthwash in a cup. Do not dilute the solution with water. Rinse your mouth for 30 seconds and move the liquid side to side from one cheek to the other inside your mouth. Spit the solution out into the sink. As you know already, sweet, sugary, and sticky food cause cavities. Their consumption must be minimized as much as possible. If consumed, it must be consumed along with your meals. One must consume a balanced diet which is rich in carbohydrates, proteins, fats, vitamins and minerals, along with a lot of fibrous food which helps keep your teeth clean. Milk, curd, certain fruits like fig, dates and dried grapes are rich in calcium, and potatoes, grains, grapes, spinach, tomatoes and carrots are rich in fluoride. These minerals keep your teeth strong. Regular visits to the dentist once in every 6 months can help you prevent cavities and detect cavities early. Even though you may take all the above measures to clean your teeth, some dirt and stains still remain, which has to be cleaned professionally by the dentist. Cavities in their initial stages can only be detected by the dentist. In this stage, they are reversible. A cavity usually appears as a small black spot on the outer surface, whereas in reality, it is much bigger when seen in the inner layers of the tooth. The dentist can also identify certain teeth that are more likely to get cavities because of their shape that tends to collect the food particles and cannot be cleaned thoroughly. The chewing surfaces of these teeth can be sealed using certain pit and fissure sealants rich in fluoride and prevent cavities. Sometimes cavities are seen on other surfaces as well, and these can be prevented by a procedure called topical fluoride application. The fluoride strengthens the teeth and prevents cavities. Following the above mentioned 5 golden steps, one can easily prevent cavities completely and can help you keep your teeth and general health in a good condition for a lifetime. As the saying goes, prevention is better than cure.